I think it's already being recorded, Brian. I just
Oh,
see the notification.
Mhm.
Yeah.
all right. Good morning, everyone. Welcome to the January Brooklyn Developmental Disabilities Council monthly meeting. Thank you for getting online, staying in the house and being warm, not having to travel anywhere. Appreciate that. Have more people than I was anticipating today, so that's good. Um, so hopefully everyone made it through okay yesterday. If you're from an agency, hopefully your program and people you support are safe and doing well. I know Rochelle doesn't think it was that bad, but it was pretty bad. Um, so again, thank you for being here. So we do have a really good presentation coming up from Visions a little bit later, but first we'll do our normal business updates from the council, updates from OPWDD, and potentially updates from IAC. But if they don't come on, I do have their main update would probably be based around the governor's executive budget. So I do have their notes from that in case they aren't unable to join us today. So the first thing I want to start off with regarding the council, as you all should have seen from my emails, we are not doing our in-person event. We are instead focusing our efforts on the 5-borough virtual legislative event. That is going to be Friday, March 6th at 10 a.m. via Zoom. However, this year, unlike past years, we're changing up the format. We're going to do more of a panel style, focusing on 4 main topics, instead of just having each borough kind of introduce and focus on a topic. The 4 main top panel discussions that we're going to be doing are early intervention and education, health equity, housing and aging, and workforce. And each topic is going to hopefully be chaired by a leader from our field, have participation from a professional, family member, and an elected official on it. And when we started promoting this event with the change of format, we definitely got a little more interest, it seemed, from some of our state partners and our elected officials. So hopefully they'll show up and come through, and I think it'll be a really good event. So the invites went out. It's on our website. Please, you have to register in order to get the Zoom link and be able to attend. I believe it is limited. I think it's like 1,000 people or something like that. I forget what the number is, but you do have to register to be able to sign on and get the Zoom link and details. So again, that's Friday, March 6th at 10 a.m. via Zoom. And there will be language translation via the Zoom closed captioning, because now they offer many languages with the help of AI. So that's how most of the language translation is going to happen for the event. All right. Before we go to OPWDD updates, I know we have a bunch of council co-chairs on from our committees. Do you guys want to plug meetings, give updates from your recent meetings?
Good morning, all. How are you? Brian already gave the update on the legislative, the changes and what's occurring. Also, on this Thursday, we'll have our legislative meeting, where all is invited to participate, and I know we should be having some update from Rochelle, who is very good with the governor's budget. So she'll be speaking a little bit about that, giving some information to the family so they can, we always say layman terms, so they can understand what's happening and how we can support each other. Good morning, Dr. Marie. If you want to say something, you're more.
No, just basically piggybacking on our next legislative committee meeting is February 12th at 10 a.m., the usual link. And if you have any question regarding your legislators or how to reach them, we'll try to have an interactive committee meeting. So feel free to bring your questions to the meeting. Thank you.
Thank you, guys. Debbie, before I get to you, Paolo, you have a question?
Yeah, I'm sorry. I don't want. It's going back to the to the meeting with the oh my God, I'm just blanking in the name in the announcement that you made about
The legislative town hall?
the legislature. Thank you. And you mentioned AI interpreter as the method that you guys are going to use. Let me say that I understand why is that used because it's cost efficient, but have we tested in terms of the accuracy, if it's clear, if it, things like that? Because I'm concerned. I mean,
Well,
AI is fantastic,
yeah,
but
you can
I have
test it right
concerns.
now. like anyone on here can test it right now. You can choose your language when you choose the closed captioning. The benefit to it is it's not necessarily about cost. When we've had interpreters in the past, it was limited. They had to be in like kind of breakout rooms and people had to be separated, and that's not going to work with the panel style as well, I believe. But also, there's a lot more language options with the closed captioning built into Zoom. I forget how many languages there are, but I think when we've done it in the past on the 5-borough event, I think we had 2 or 3 interpreters at most. And with this, I think it's like 40 or 50 languages that you can translate it into. Is it 100% perfect? Absolutely not. Because I'm sure there's terms that we use in our field that AI and the closed captioning is not going to know what it means, or we use so many acronyms in our world, it's probably going to throw it off a little bit. But the fact that you on your end could pick one of the 40 languages that works for you, and it'll interpret just for you without impacting other people in the meeting or having to have someone talk while someone else is talking. We're going to see. I know other meetings are using it. I know it's not 100% perfect, but I think it'll provide more options and open up more opportunities for people to get it translated in exactly what language they need.
And also, Brian, this is Chris, just to add in, it also is available in the transcript when you switch it to translation too. So the person can read it in their language as well. It's also on Zoom and Ring Central.
Okay. Yeah. So I hear your concerns, Paula, and I'm with you. But hopefully this is one part of technology that's going to work in our favor, because there are so many more options of what we can do just getting 1 or 2 interpreters in and trying to make it happen with people. All right, Debbie, you want to give an update on your committee?
Yes, I do. Good morning, everyone. I'm co-chair of the Provider Parent Information Committee with Rosal. We usually meet the second Wednesday of every month. Our last meeting was on Wednesday, January 14th. We had a great presentation and great explanation done about benefits for Medicaid, Medicare, and Social Security, disability insurance, as well as SSI. From Care Design, it was excellent. Also, we did get the slides, so if you need them, you can contact Christopher and myself at the Advisory Council's website. But not today, because we're not in New York City at the moment. But it was a great meeting, and we also want you to know that our next meeting will be on Wednesday, February 11th from 10 to 12. While you have me here, do you want me to do the advisory to get it all out of the way?
You can, but just real quick, so that the Care Design PowerPoint, it was emailed out by me, and
Yes.
it's also on our if you go to the Brooklyn Council website, it's on the resources page, so you can find and download and view the PowerPoint. It was really good from everything I went through it after, and Rochelle had shared it with me after the meeting. It was a really good presentation that'll be really helpful for many.
Yes, it was a big help because it also explained what many families didn't want to realize, that our children are called disabled, adult children called a DAC or adult child survivor, because our children can collect under their parents' social security number because they were disabled before the age of 22. Okay, and I'm going to do the advisory quickly. First, I want you to know that we had our Brooklyn Resource Fair at the Home Press Library. We were packed beyond capacity, and that's a small library. It went very well. On our last meeting was on January 20th. We discussed the statewide, what was coming up with the statewide reimbursement and other issues that affect the advisory council. It's very well attended. Now, due to the fact in February, we normally would do our meeting on the 17th of February, but we can't, so we're switching and we're going to do it in person. It's going to be both in person and virtual at the Grand Army Plaza Library, and we're going to have from OPWDD, they're going to do the CAS system. So they will be coming down. It'll be from 10 to 12 at Grand Army Plaza Library. First floor information. I want to thank Carrie Banks for her help. Also want everybody to know that it will be on Zoom, not on Ring Central. You need to pre-register so you can get the Zoom link from the library. and it will be on the Advisory Council's website, which is BFSSAC.org. The next meeting for us will be, as I said, on the 9th. Now, on our next resource fair will be on Friday, the 13th, from 11 to 1 p.m. We are booked beyond capacity for any providers, but all providers are still welcome to attend because we have an information table where you can leave your information with us. And if a parent wants to speak to you or that you can walk outside, we have plenty of places where you two can sit and meet. So, and Christopher, what's the name of the library we're going to be at? The Kensington Library, which is on 18th Avenue near the F train at 18th Avenue stop. So everybody is more than welcome to come. Thank you. I'm all done.
Thanks, Debbie. Melissa, do you have any updates from the Housing Residential Committee?
Yes, good morning, everyone. The residential committee met on January 9th. We had a presentation by CCO ACA, Crystal, and her team presented. I think it was a well-received meeting. Our next meeting will be scheduled for the end of February, and I will send that information out to Brian.
Great, thank you. Trudy, do you have any updates from the Meaningful Day Committee?
Yes, hi, good morning, everyone. Happy snow day or no snow day, however it is. Okay, so our Meaningful Day Committee has been very successful in hosting a lot of informational workshops. The first one was in January. Specifically, we provided information about FAPE, free appropriate education for students aging out of 22, what to look for, and any other changes coming up. Then we hosted another information session on residential, Brooklyn DD's Council, residential on January 9th, 2026. It was very informational. Also, there was another discussion understanding housing options and services. And on January 15, not too long ago, we provided a very informative workshop on employment services, which was very helpful to understand what services are there on Access VR, supportive employment, different types of supporting employment, and we had a very good outcome. So the next one is probably going to be on April 22nd, but the topic is to be determined, but we are planning to either more employment or education.
Excellent, thank you. And as always, you guys know they make great flyers, and you will find them shared on our social medias, our website, and emailed from me. All right, Chris, you wanted to share something?
Just wanted to compliment that committee because, to be honest, I did attend a couple of times, and I have to say that that's been like one of the most really fascinating committee. So I really strongly will remind everyone to please attend that, because for once they're listening, they're advocating, and it's a really good committee to attend. Oh, and I'll be honest with you, I'm seeing a lot of good committees this year, stronger than we ever did in the past. So I just want to put a compliment in that.
Well, I'm sure they appreciate that, Chris. Thank you.
And Brian, let me know when you're ready for me to do the MTA report.
All right, that'll be later on. Thanks.
No, I just said let me know when you're ready.
Yep. Did I miss any committees? I think that was it. So at this point, I'm going to pass it over to Nina from OPW for the OPWDD update.
Good morning, everyone. I'm so happy to see so many faces despite the extraordinary weather that we had yesterday, right? And people are digging out today out of the snow. So I want to start with the updates for regional disability health clinics, and because the health equity remains a top priority for OPWDD and for our governor. Last year, as you remember, we have announced a 25 million grant to establish regional disability health clinics. And we have received applications that are being reviewed right now, and we will anticipate announcing awards in spring 2026. The applications were available for Article 16 clinics, Article 28 clinics, diagnostic treatment centers, health centers, or off-campus hospital clinics. And the main criteria was to prioritize projects that will expand and enhance dental services, improve wheelchair accessibility, create a sensory-friendly environments in the clinics, and also increase access to specialty physical health services, especially in healthcare deserts outside of towns in New York City area. I will turn over to strategic planning and engagement. As you know, last year we have completed a series of forums related to 2023-2027 strategic plan. We had in-person forums, conferences, forums with the advocates, statewide virtual forums, commissioner met with families. We collected the feedbacks. We also had non-English forums in Spanish and in Chinese. And we are currently finalizing the annual strategic plan update, which we plan to release at the end of the month. And also we will continue with scheduling forums this year. Another critical area of focus in our system is a task force on aging. Last year, we started this initiative. It's a time-limited subcommittee of the DDAC, and members include self-advocates, families, providers, CCOs, subject matter experts in aging, health, and disability. The workforce committee met a couple of times, and they are focusing on 4 key themes: non-residential supports and services, caregivers and circles of support, health and wellness, and accessible housing. The non-residential supports and services theme covers what people receiving OPWDD services do during the day, including retirement options, employment, day services. It includes services provided outside of OPWDD, but it doesn't include housing or residential services or services and supports for caregivers. This second priority, caregivers and circles of support theme, will cover how paid and unpaid caregivers and circles of support can receive appropriate options, opportunities, information, accessibility, availability of resources, how to support to meet changing needs with heavy emphasis on future planning and the tools and resources needed to enable planning. The next theme is health and wellness, which cover how people changes and wellness changes for the people as they age. Major sub-themes are physical accessibility of certified and non-certified residential settings, policies that support universal design, supporting people through housing transitions. It does not include access to housing, which is being tackled in other venues and initiatives. On December 16, the task force discussed vision statements for each theme and aligned on prioritization criteria for future recommendations, which should be achievable, time-bound, and meaningful. And over the course of 2026, the task force will hold a series of panels and information gathering sessions to learn from and discuss ideas related to each of the topics, and they will be developing actionable recommendations. The task force will be added to the DDAC website, and updates will be provided in DDAC meetings, and any questions can be submitted to DDAC mailbox at OPWDD. I can share that in the chat later. Next, I want to highlight and measure, the updates actually with the home enabling supports. As you know, it's our new waiver service that will support assistive technology, remote supports, and health assessment and coordination services for people who live in the community and people who would like to have more independent life and less reliant on physically present staff. We have selected 8 providers throughout the state. In New York City, we have 3 agencies. I think it's human, oh my God, I'm blanking out. It's Center for Family Support, PCCS, and one more. And Human Care, no, it's not. Center for Family Support, ADAPT, and Person-Centered Services in New York City. Right now, we are working with IT and with the agencies on intake and planning tools to implement a home enabling support service. And this service is expected to be available in early 2026. So we are in the final stage of launching this new service. I also want to highlight a communication initiative led by people with developmental disabilities. Probably you know that in 2024, we launched the podcast, Accessing Life. The podcast is hosted by OPWDD employees, Chasta Finn and BJ Stasio, and our OPWDD communications team. We have now 12 episodes available covering topics like accessible technology, voting, employment, shopping, supported decision making. The most recent episode was recorded at SANE's annual conference and focused on SANE's rights. And the name of the last episode is Discover the Power of Your Rights. And episodes are available on the OPWDD website. So moving to the next, with self-direction, we know that evaluation was completed last year. The main areas, recommendations are focused on budgeting improvements, expanding access, supporting people without a strong circle of support. The plain language in the full report is available on our website. Another important support for individuals and families is the OMBUDS program that is operated by Community Service Society of New York State. They provide assistance with eligibility services, system navigation, and OMBUDS program does not replace the care manager's responsibility or the justice centers, but provides supports when issues remain unresolved. And we anticipate, we are working on sharing an annual update in late spring from the OMBUDS program. And finally, I'm going to quickly mention about New Americans with Disabilities. We supporting New Americans, people who are coming to our country with developmental disabilities. It's also remain a critical equity focus. OPWDD is partnering with New York State Office of New Americans through the Ona Ramirez June initiative. Because New Americans often face language, cultural, immigration-related barriers when accessing services, and the support is available through a confidential hotline with more than 200 languages available. And we provide Know Your Rights materials and trainings. And OPWDD has recently developed a training for the care managers and CCO staff. It's a dedicated training in our SLMS system. And so we encourage referrals, new referrals for those new immigrants to go through New Americans organization. And I can share their email address or connect with our OPWDD Diversity, Equity, Inclusion Office. And that is it for me for today.
Thank you, Nina. And regarding the Office for New Americans, I think they presented for us 2 months ago. So if you go to the council's YouTube page, and I think on our website, you can still find their presentation in video, and I think they shared their PowerPoint with us for you guys. It was great, and it's going to be a very big help. So I'm glad that OPW is backing them and working with them. I think it's really going to help our field. Nina, I do see a couple of hands for you. So first one up was Carrie from Brooklyn Library.
Hi, all. Nina, I have a quick question. Do the people, the new Americans that are eligible for this project, do they have to be citizens?
No, it's for new immigrants.
Great. Thank you, Nina.
Mhm.
And Rochelle had her hand up for you.
Yeah. Good morning. Thank you, Nina. It was as always, a very comprehensive report. I just wanted to inform folks who may not have known that I am a member of the Commissioner's Task Force on Aging, and I would encourage any of the members of the council who have concerns or want to give some input, you can contact me. You don't always have to go through the DDAC email, and I would be happy to incorporate your concerns into our discussion.
Thank you.
All right, Chris? Chris?
Hey, Nina, just wanted to thank you for one thing. So you can please let this to the commissioner know because it's in her budget on the list. MTA, you guys added in the MTA budget as well in your OPWDD budget. First time we ever seen that. So I just want to be clear for the record. So can you please let the commissioner know? Thank you so much because Carmel Aurora was actually shocked. He almost passed out. But I'm glad he passed out on the snow, not in the ice. If you know what I mean, Brian, as a little snow joke moment, as we can drink to that, Brian. I agree with you on that. But I do want to thank you, Nina, for that. Can you please let the commissioner know? Nina, I can't.
I hear you, Chris. Thank you. I don't have any updates for the budget, but we'll have more information in upcoming weeks.
No,
And I'm sure we're
Nina.
going to get plenty from Kate.
Right.
Nina, Nina, if you look on the commissioner's newsletter, she has it mentioned on the MTA. So all I'm saying is, can you please let her know? Thank you. That's all I'm saying. Make it easy.
Okay. Thank you.
All right. Thank you so much, Nina. Appreciate your update and your report and answering questions. All right. I'm going to pass it over to Kate Hoy from IAC.
Hi, everyone. In traditional or true remote work style, I am dealing with a neighbor who sounds like they're coming through the wall. So if I pause at any point to make sure that they're not, please bear with me. Otherwise, it's great to see you. And let me jump right in. There are a few announcements, and I do need to jump off afterward. I apologize for a meeting, but I'll stay for any questions, and if there's anything that I can take back to Winnie and the organization, please let me know. And I know Brian will let me know as well. So just to jump in right at the top for federal, Congress is working through appropriations funding. As you may recall, last fall, the budget was due before October 1st. We had a government shutdown. Some of the bills were passed. Other bills were passed in a short term that are required to be voted on and require new proposals before January 30th, which is Friday. So we are watching that. The bills were passed. A lot of them were in the House. So a lot of the votes have to be voted on. Sorry, bills have to be voted on this week by the Senate. The funding was mostly kept pretty stable for Health and Human Services and Center for Medicaid Services. It's at 2025 level funding. There's also $2.5 billion for the Administration for Community Living, and $4.1 billion for CMS. For education, bipartisan proposed agreement was released last week to fund the DOE or Ed Department at $79 billion for 2026. That's $217 million above 2025 levels, so a slight increase. Importantly, it's a rejection of the Trump administration's efforts to downsize and eliminate the agency. The proposed budget deal, and again, it's just proposed at this point, would be a slight increase for special education programming. I mean, very small. but it is a slight increase, and it includes explicit language that prevents the unauthorized transfer of the department's statutory duties to other agencies. Again, this is something that we're watching closely. The department has already moved day-to-day management of CTE, or career and technical education, to the Department of Labor, and they're in the process of transferring management for 6 other programs to federal agencies, which would split them apart and their oversight apart. They would no longer be maintained under a dedicated agency and staff. So the House and Senate fiscal year 26 bill would require that the Education Department make formula grants available to states like IDEA, Title I, and districts on time, and to issue funds at levels dictated by Congress in the funding bill. A lot of this seems very obvious, straightforward. The Trump administration has repeatedly threatened to withhold funds, has delayed funds, has impacted the regular, the stability of funding for states and districts in the past year that they've been in power. It would also add a new requirement to maintain the Education Department's staffing at levels necessary to fulfill statutory responsibilities, which is key, including carrying out programs and activities funded in the bill. The proposed Education Department funding plan was included in a Consolidated Appropriations Act, so there are still budget bills that need to be passed for DoD, Department of Defense, Labor, Health, and Human Services, which is often referred to as Labor H. That's where the education bill is. Transportation, Housing and Urban Development, and related agencies. So the vote was expected to be voted on before January 30th. But after the horrific events in Minnesota this past weekend, some of these appropriations and the votes are maybe delayed. So we are watching that closely. So there may be another shutdown. It's possible, but we'll all be watching news for that. Here in New York State, the executive budget was released on January 20th. I can put a link to the budget documents in the chat for everyone, or if anyone happens to have, actually, it's easy. Hold on. Pardon me. Link to budget documents. $260 billion in all funds, $157 billion in state operating funds. The governor referred to this as historic investments in childcare and the health sector. That was the emphasis of the budget. And we're using a CPI of 2.8% for 2027. The governor, it was released on Tuesday. Also, I put the budget documents themselves in the chat. I'm sorry, there's a lot of numbers and information I'm going to go through. So if you need anything, I'm just going to read from our overview, and then please stop me at any time if you want me to go back or review something. So the governor eliminated a $4.2 billion budget gap with higher than expected income tax revenues. Importantly, there was no additional tax on the wealthy here in New York State, which many electeds had been calling for, but there's no additional tax revenue expected by increasing taxes on any constituents here in New York State. However, we are looking to a $10.3 billion federal funding cut, including $3 billion directed at Medicaid specifically. The overall budget is $260 billion, which is a 0.7% increase over fiscal year 2026. She included a number of housing initiatives and childcare proposals, which I'm not going to go over today, but we'll be talking about for many months to come. I hope, in the councils, individually, and then also at IAC. So watch this space. There's new funding for inclusive SUNY and CUNY programs that will include a partnership with SED or the State Education Department to establish a formal transition process from high school to college for students with IEPs. There will also be the establishment of an Assistive Technology Innovation Center created by Empire State Development to foster collaboration between researchers and private partners to accelerate the innovation to market pipeline for new assistive technology. And she proposed to expand the Fashion Innovation Center with a grant for designers, entrepreneurs, and researchers to promote the development of adaptive clothing for people with disabilities. She has also included direction to the Department of Health to submit an application to CMS, the Center for Medicaid Services, to return the Essential Plan to a basic health program, which would preserve cost-free coverage for 1.3 million New Yorkers. For the 450,000 New Yorkers who would lose their current Essential Plan coverage in this transition, DOH will negotiate with the federal government to develop affordable coverage options to ensure continued access. Just to pause there for a moment, that request to the federal government for funding for 1.3 million New Yorkers who have the Essential Plan is dependent on the federal government agreeing. So we are watching that. Otherwise, we are looking at a significant funding cliff, and we'll need to find revenue. Either people will lose their coverage, or the state will be required to find something else. But it is a real concern, and there's no guarantee, as we all know, that the federal government will either permit the Essential Plan to continue and/or will fund it. So the governor also pledged to protect New Yorkers by advancing legislation to ensure that New York can set its own immunization standards that would guide school clinical practice and insurance coverage. As you may have seen, one of the most recent vaccine panels has recommended that parents make their own decisions with regard to polio and other vaccines. The DOH Disability and Health Program, in collaboration with the Office of the Chief Disability Officer, will collect and analyze data about healthcare experiences to identify barriers to care and inform an action plan. So we will certainly provide more information about that. Some specifics include for OPWDD, an overall increase in OPWDD funding of $342.8 million, which is a 4.6% increase. A recommended 1.7% TII. If you remember, we have been requesting 2.7% as a coalition of provider agencies. So that is, a significant difference. She's recommending 1.7% for the O agencies, the different offices, which does not include CCOs, and a 5% increase in family care rates. There's also $15 million for OPWDD independent housing initiatives, $30 million to fund new OPWDD services, $39.3 million to support minimum wage increases for OPWDD funded positions, $30 million to fund new OPWDD. I'm sorry, I already said that. $33 million reduction from $97 million to $63.4 million for family support services, which is in line with past year's spending. DOH, really critical, no recommended early intervention rate increase as we continue to see that system decimated. So we will have much to say and much to advocate for whenever we go up for lobby days. And as you speak with your legislators, the state of the early intervention system is dire. Families are not receiving the services that they need on time. They're not receiving the evaluations that they need on time. And we are, desperately concerned about all of the administrative changes and other changes. New York State is 48th in the nation in terms of its delivery of early intervention services to infants and toddlers. So to see no early intervention increase was, again, not surprising perhaps, but unbelievably disappointing. There will be $100,000 to alleviate barriers for hearing loss, a standardization of ABA. Again, these are proposals to establish centers of excellence. I'm going to try to go a little faster. Limits to the personal care administrative reimbursement to 15% of total costs. An expansion of the scope of practice to allow physician's assistants to practice independently, medical assistants to administer vaccines, and changes to state law to allow DOH to oversee licensed healthcare professionals' scope of practice. $694 million to implement 2 workforce programs for education and training for health, behavioral health, and social care workforce. For the state education department, there was, again, for 4410s or special education preschools and 853s, which are school age, state approved special education programs, that budget and those increases is are done through a tuition methodology letter that occurs later in the spring, which is why our lobby days for education for the 4410s and 853s occur later in the year. At this point, though, for any items that have to be negotiated in the state budget, like FAPE 22 and funding for FAPE 22 and legislation to ensure that students can remain in school through June 30th of the year that they turn 22, those have to be done now and during the budget process. But funding, the specifics of funding for the 4410s and 853s happens later. So right now, talking about state aid, $1.6 billion for school district funding, including $561 million for UPK. And a number of incentives and scholarships for early childhood educators, extending OCFS childcare program licenses, $45.6 million in capital improvements at the 5 state-owned schools for the deaf and blind. That's a very quick overview of the proposals in the governor's executive budget. The next steps will be to lobby and to advocate with our legislators in the House, in the Assembly and the Senate, so that our priorities and needs can be included in those one House budgets. And then the Assembly and the Senate will, we'll have our town hall for the DD councils in hopes to influence their one House budgets. And then they will, come together with the governor and negotiate a state budget that should be, is due by April 1st. But again, the governor hasn't actually committed to on-time budgets. She said that it's more important that they get it right than it's on time. So upcoming legislative budget hearings will be held in Albany. They're going to be live streamed. We'll put a link in the chat. Elementary and secondary ed are on Thursday. Mental hygiene is on February 4th at 9:30. They're all at 9:30 a.m. And health and Medicaid will be on February 10th at 9:30 a.m. That is also IAC's lobby day. So there will be briefings for the IAC lobby days on February 5th and 6th, and we will send out the invites for those. I'm gonna just to, in general, our advocacy asks so that we all have it handy. Targeted inflationary increase of 2.7% is what we're looking for. There's a number of CareForce investments and CareForce affordability initiatives, including housing lottery preferences. For education, I just reviewed the FAPE 22 ask, which is to pass legislation in line with the New York State Supreme Court ruling to fund districts and enable students to remain in school through June 30th of the year that they turn 22, and a 2.8% rate increase. But again, that rate increase is going to be negotiated later in the year. So it's really FAPE 22. Early intervention, we're asking for an 8% increase to support the rate study. I'll have more on this, and we will send around materials, and to implement the 5% state plan amendment that should have started on October 1st, 2024. So here in New York City, and Brian, I'm gonna, not much more, actually, there's just 2 more minutes. Here in New York City, we have a new mayor, we have a new speaker, Julie Menon, we have a new schools chancellor, who I'm sure many of you have had the opportunity to see and hear with the recent snow days, or rather remote learning days. We have a new education chair in the city council. It's Eric Dinowitz from District 11 in the Bronx. He's a former special education teacher. And we're watching and speaking with coalition partners about the impact of the new TrueCare implementation, in particular here in New York City. We will roll out some pilots. There is dedicated, or there will be funding for that. And while we are here at IAC and with our providers, absolutely supportive of increased childcare opportunities for families and certainly for youngsters, we are concerned that our 4410s and early intervention programs are also funded at levels that enable our programs to succeed, our workforce to be adequately or to receive pay parity, and for youngsters to get the evaluations and services they need in a timely manner. So for the future, IAC lobby days are on February 10th and 11th. There will be a rally on March 10th at 11:30 in the War Room up in Albany. There is a rally in the Valley on March 13th. And watch for March 19th, the one House budgets will come out. So we're looking to see certainly if our advocacy was effective and if our priorities are included in there. And finally, just to, I believe Nina mentioned, or if she's not, there's an opportunity for comment on proposed regulations to improve Article 16 operations. And I'm reading there from OPWDD's language. The proposed regulations would clarify the requirements to receive services at Article 16 clinics, quote, ensuring consistent understanding of the eligibility requirements for treatment at an Article 16 clinic. The proposed regulations are intended to provide regulatory relief in the use of medical director, the frequency of treatment plan review, and the use of audiovisual and telephonic supervision. IAC will put together and is putting together a work group on these proposed regulations. There is real concern that implementing these regulations will limit the number of youth in particular and people with developmental disabilities who may not have established OPWDD eligibility. We know that for many reasons, some people receive their services, particularly OTPT and ongoing psychotherapy or counseling, in Article 16 clinics, especially because those providers do have expertise, of course, in developmental disabilities. The concern here is that folks who have not made it through the eligibility process or for any number of reasons have not gone through it will no longer be able to access those services, further limiting the availability of, qualified professionals to provide those services. So there is an opportunity for comment. The public comment period ends March 1st, 2026. And we encourage everyone to comment. I'm going to put the full text of the proposed regulations in the chat. And again, the comment period closes March 1st, 2026. If you have any questions about that, please let me know. That's it.
Thank you so much, Kate. You always provide a ton of information. I have one question regarding when you talked about the preliminary budget, the proposal from the governor. I know Matthew from IAC shared out the preliminary highlights. Are you guys okay with me sharing that with the council mailing list?
Yes.
So a lot of the stuff that Kate talked about regarding the budget, breaking down with OPW, early intervention, all that, I have the breakdown, the highlights, and it includes the links to the budget hearings that are upcoming that Kate talked about.
Fabulous.
So
Thank
as
you.
soon as this meeting ends, I will forward that out to you guys so you have all the bullet points she was talking about. Debbie has her hand up for you.
Hi.
Hi. Okay, can you just re-explain? Is Family Support Services losing money or we're staying? I got a little mixed up, so can you give me I'm not asking for a big explanation, a brief.
I would defer to OPWDD. My understanding is that the funding is actually in line with what has been spent in past years. But yes, it's a reduction, but please, Nina.
That's what I wanted to
We do not have the updates for FSSRFB, so we're still waiting for the information from the central office.
And this is by the way, this is just the governor's proposed budget. So all of this is up for negotiation and debate.
I want you and Nina both, I do understand that. But as chair of the advisory and a member of the statewide, I keep getting, between text, emails, they're all asking me the same questions. So I keep telling them I'm waiting, it's the governor's budget, but I'm also trying to tell them that's not the way they send it too. So that's why I was asking if it was possible, but I'm patient. I just want everybody
Debbie,
else to let me wait until the full budget come out.
Debbie, just a lot of the breakdowns and conversations that are happening are that while it looks like a cut in the proposed budget, it's just more in line with what was actually being spent.
Which
I understand that, but
I will speak.
You should see the panic I'm getting.
Speaking personally, I know that, from the agency side or as a former FSS program provider, if there were any barriers to spending, I know that, lots of programs, especially around family reimbursement, we're concerned about, the restrictions on reimbursements. I know there's been so much conversation around that. I'm not wading in, but if organizations and families would like to advocate to maintain that funding because of limitations, time is now.
Thank you very much for
But
the
for anyone,
answer. And
yeah,
you too, and Brian.
for anyone, just for clarity, if you look at the language from last year to this year in the budget, it went from 97,033,000 to 63,400,000, and that's where the questions and concerns are coming from. So it's about a third cut based on appropriation, but then they're defending it as appropriation versus what's actually being used and spent. But then it brings in the other conversation of access to use it. And if the access is not there, that is why the amount being used is less than what's being appropriated. So we will hopefully get clarity on that. Chris, you have a question for Kate.
Thank you, Brian, for the clarification.
You're
I'm
welcome.
just thanking you for that. Thank you.
You're welcome.
Hi. Just to let you, Kate, just to share in also, this also, not family support, going back. If you look in the OPWDD, but not just OPWDD, and I'll be one of those panels speaking in transportation as well as Debbie in February 3rd. What we also need to prepare also in that category, because a lot of day habs using transportation. We need to just remind a lot of our elected officials that transportation, when they're getting transport from day hab to home or to a clinic, we just need to make sure that that transportation is still in there, because there are some people, and I'm not going to use names because it's always, you got to play the drama violin if you watch Bar Rescue, hearing all their excuses. We just need to be very clear. The information needs to be very clear. And I know, Rochelle, I think you're on the same page with me. Information must be cleared and must be, as Brian, you said it as well. Information has to go out in the right direction, in the straight direction, not making a left, making a right. One way information must go in. Because right now, what I'm seeing right now in all categories, it's all proposal. It's nothing. We all just need to remind our elected officials. Seniors and disabled people uses transportation. Seniors and disabled go to disabled people go to day hab. Or when people turn to seniors, they go to senior centers. They need to look at the numbers. They need to go out and look for themselves, but continue advocating as well. And Kate, just to let you know, I will be speaking like I did last year at the transportation panel this year, as well as this year. Debbie will be joining with me, and thank you for putting that link in, because their system is working now. That's all I have to add.
Thank you, Chris, thank you for bringing that up. There are hard dates if you plan to testify at any of the upcoming hearings in Albany. Please review. I just put the link in the chat. You scroll down, you'll see first the dates of the hearings, and then the submission dates for written testimony if you plan to testify in person, when your written testimony has to be submitted, and then et cetera. But please review the dates.
I already did, Kate, because I was the first one registered. No, I'm just sharing to everyone. I was the first one because
that's cool.
The two chairs who are doing the joint committee are asking. They asked the secretary, saying, "Mr. Greif, are you coming up to speak?" Because they enjoy when I show pictures, not words. That's the strongest weapon. And I will continue doing the pictures, because, as you see, that's where I have that for a reason behind me. So Michelle can see that, because last time she didn't see it. So that's why I'm turning my head down. And you got to keep your sense of humor.
Chris,
thank you.
Thank you. We have time for two more questions for Kate, and then we have our presenters that have been very patiently waiting for their time. So I don't want to have them waiting much longer. So Rochelle, you have a question for Kate?
Yeah, well, it's more of an elaboration. Thanks again, Kate. But I wanted to talk a little bit about the TII, the targeted inflationary increase. I think it's, critical to advocate for, to enhance what the governor offered. I was a little pleasantly surprised that she offered as much as she did, as the 1.7%, but it's really inadequate for our providers and also for people in self-direction and their budgets to keep up with inflation. So I think on those levels, it's critical. What I wanted to say particularly is this is the third year that the CCOs have been excluded from this increase. You can call it a COLA, you can call it a TII, but they have gotten no increase for now 3 years in addition to a 4% reimbursement cut. And I know that there's, the understanding was, and it was true that, the CCOs had certain reserves. And I can tell you those reserves have been significantly depleted because of that. And they are having difficulty in actually having enough revenue to provide increases to their care management staff. And so they're experiencing increased turnover. And this isn't not good for any of us because the care managers are the link for everything. You cannot get any service from OPWDD without the input of the care manager and the advocacy of the care managers. So I really feel like it's time that that providers and families and individuals advocate for their CCOs. Because if this trend continues, we're going to see a significant erosion in the quality and capacity of CCOs to support us. Thanks.
And lastly, Trudy.
Hi, Kate. Question. You probably have mentioned it, but I wanted to double check. So I know for the school year 2025, 2026, under the revision stated allowed students to graduate until the age of 22 until this June. Do you know anything about 2026, 2027? Are they graduating at 22 also, or we don't know
So we
yet?
know what we know what the New York State Supreme Court ruled. We need legislation that specifies that it's through June 30th
Okay.
for all kinds of reasons. Right, Judy? I mean, as an educator, I think you can make the case better than anyone that students shouldn't just be unceremoniously dismissed from their placement at, whatever day they turn 22. And for teaching, right, for your budgets every year,
Yeah.
for class sizes, right? It makes no sense for a number of reasons. First and foremost, for the child or for the young adult. We need legislation included in the budget that specifies that it's June 30th of the year, and we need the funding because otherwise districts are on will need to find that funding without funding from the state.
Got it. Thank you,
Great
Kate.
question. Yep. Thank you, everyone.
Thank you so much, Kate. And if anyone has additional questions, please feel free. You can reach out to Kate. You can email me. I'll get it to Kate. But like I said, after this meeting, I will send out the IAC budget highlights that she discussed with links to the upcoming hearings. Now transitioning to our presentation. So I'm so happy that we have Kathleen McGuire, Elizabeth Lee, and you just left my screen, Khadija Bari from Visions. Visions is an organization services for the blind and visually impaired. Rochelle and I had met with another one of their colleagues previously to discuss them coming to present and the services they offer for the field. And I will pass it off to you guys to take over. If you need any sharing or anything like that, let me know and I'll make you guys co-hosts.
Thank you so much. This is Khadija speaking. Thank you so much, Brian, for having us and to give us a space today. My name is Khadija Bari. My pronouns are she, hers, and I'm the Director of Job Placement Services as part of the Workforce Development team at Visions. I'll talk a little bit about Visions and what our team does before I pass it over to my colleagues. It's really nice to see a couple of familiar faces here, and so far this morning I have learned a lot. So thank you again for having us today. So Vision Services for the Blind and Visually Impaired, we are actually in our centennial year this year, so we've been around for a minute. Our mission is to help people that are blind and visually impaired achieve independence, and we serve individuals of all ages. Independence can mean different things for different people depending on where they are in life. So some of the services that we provide are orientation and mobility, vision rehab therapy, which I will let my colleagues elaborate on. And we also provide social casework services for people to receive short-term mental health counseling, connecting with benefits. And my particular team, which is workforce development, we provide services to help people get connected with employment and also obtain assistive technology training services. Vision serves Not all of New York State, but a decent chunk. We serve the New York City 5 boroughs, Long Island, and the 7 counties of the lower Hudson Valley. Visions has 3 physical locations. We have administrative offices in downtown Manhattan at 500 Greenwich Street. We also have an older adult center in Midtown at West 23rd Street. We also have a residential vocational training location upstate in Spring Valley, New York, which is in Rockland County. And we also run some recreation programs during the summer there. The way that we primarily get connected with the participants that we serve is through the New York State Commission for the Blind. For most of you here are probably familiar with Access VR. So the Commission for the Blind is the sister agency to Access VR. So in order for us to be able to serve individuals that we get through the Commission for the Blind, their primary disability has to be that they are certified as legally blind. However, a lot of the participants that we serve also have secondary disabilities, but in order for Visions to be able to support them, legal blindness has to be their primary disabilities. So my particular team in workforce, we provide job placement services. So that is connecting people with employment opportunities based on their employment goal. We work with individuals of all education and experiential backgrounds. So from folks who may not even have a high school diploma to individuals perhaps looking to take the next step in their career journey, such as bookkeepers, lawyers, physical therapists, and we also serve as a resource for them to connect to their next employment opportunity. We also provide, I know Access VR has a different term for it, but the Commission for the Blind calls it work experience training. So these are approximately 12-week internships that we pay the interns. So they essentially serve at another work location. So we have a good network of community partners and different size businesses who might be looking for an intern to help individuals gain experience. Perhaps they're not ready to jump straight into the job market quite yet for a variety of reasons. Perhaps they had to take a break from employment to perform caregiving activities, or perhaps they're new to their vision loss journey and are now looking to transition back into the job market based on the new workplace accommodations that they might be using to get them familiar with those. So that's something we provide as well. In terms of job coaching, so we do provide temporary job coaching to those of our participants who are placed in employment and need that support. So the Commission for the Blind essentially has us follow along with our participants after placing them in employment for 90 days, which is what Visions would consider a successful job placement, with the understanding that the participant is well settled, they're getting along with their colleagues and supervisor, and are independent and successful in their new position. So that is the extent to which that we have the ability to provide job coaching. So long-term job coaching is something that the Commission for the Blind doesn't really have a mechanism to support. And it's really, I really like what Kate mentioned earlier about the public comment. So sometimes we do come across individuals who their secondary disability, perhaps mental health or developmental disability, is diagnosed in their adult years. We have a decent number of job seekers who perhaps their disability was not diagnosed in time. Their behaviors were primarily attributed to their blindness. But it turns out as we start working with them, when it comes to, for example, in our case, looking for work, that they can benefit from additional wraparound services. We also have a program for college students. So college students, undergraduate and graduate students who might be looking for some internship experiences to bolster their resumes and be considered more competitive by the time they graduate in the job market. So we help, for example, graduate students in majors like mental health counseling or social work who might be looking for an internship placement in order to meet their graduation requirements, or college students who perhaps are not taking any classes in the summer and are looking for work experiences based on their career interests and college majors. So we also help them connect with paid, either employer paid internship opportunities. And again, if they're not paid directly by the employer, we have funding mechanisms in place with our partnership with the New York State Commission for the Blind to be able to pay them. We also provide, I think some people call this job training or soft skills training. We call it work readiness training. So all those soft skills to get you ready to put yourself out there in front of employers. So like disability disclosure, interviewing, resume, cover letter, all that great stuff. We have a week-long work readiness training for our job seekers as well. And as I mentioned earlier, we also provide assistive technology training. So based on the level of vision loss for an individual, perhaps they need to get familiar with some softwares that magnify the screen or allows them to change the contrast or the mouse pointer, or perhaps they need to switch to a screen reader, which is basically text to speech. So the software reads aloud everything that is on the screen, and you can actually entirely use a computer with just a keyboard. And our team also provides a virtual support group to manage vocational stress. So any stress associated with the job search process. It can be a very anxiety-inducing process for anyone. So we also have a virtual support group for that. I did leave my email address earlier in the chat, but I'm happy to drop it again. So I'll be sticking around if people have questions later. And at this point, I'll pass it over to my colleagues, Kathleen and Liz.
Hi, everyone. I'm Liz, and I'm the Senior Director of Older Adult Services. So for our program here, mostly the focus is older adults. So we are funded by the New York City Aging, Department for the Aging. So one of the major programs that we have is the Caregiver Program, which is providing unpaid caregiver support. So what's great about it is it's a very unique program that we have about 13 programs throughout New York City that provide support for unpaid caregivers. So for anyone who needs services for unpaid caregivers, they have to be caring for an adult age 60 and over, an adult of any age with dementia or Alzheimer's, or an adult age 18 to 59 with a disability when the caregiver is 55 plus, or children under 18 cared by an older family member. So that's the criteria for the program. So, we don't provide, a lot of people ask, is it for home health aides? No, it's not. It's a family member, a neighbor, a friend, a long distance caregiver, anyone providing support to an older adult. And of course, we're vision, so we do have a specialty if they're caring for someone who has vision loss or losing their vision and really trying to manage that as a caregiver. So the services that we provide are, we do one-to-one counseling. So it can be long-term, provide support on coping skills, stress management, resentment, sibling relationships with their parents, stress management, all of that. And then we have licensed social workers providing that support. We also have support groups to offer support. We also have workshops as well, where we have different speakers come and talk about Medicaid, how to get into Medicaid to get home care. We do legal workshops. We do nutrition workshops. We do yoga, meditation to help caregivers really manage their stress. We did a self-defense workshop. There was a lot of fear, about that. So we actually, had someone come and do a self-defense on site for the caregivers. So we're really open to kind of any sort of workshop that they want based on their feedback. We also provide information assistance, so basic information on concrete services, benefits. We help folks apply for Medicaid, SNAP benefits, Access-Ride, anything. We kind of start from zero, from a caregiver not knowing anything, what to do, step one, to the middle, or to basically, we're at wit's end. We really need so much help. We're at an emergency state, so we will step in and help them. Everyone kind of comes in at different stages through the program. So two of the other major services that I think are really important to share with you guys is we do offer respite services paid for. So we do provide temporary respite to caregivers. It's basically remote learning people today also at school. Sorry. So we do home care. So we do have relationships with home care companies. So we could actually provide up to about 4 to 6 weeks of individual home care in the home for caregivers. So it could be up to 16 hours a week and all paid for. This could be in transition for waiting for Medicaid. It could be we've had family members who said, I really need a break. I need some home care. I just can't do it right now. Or I have work. I have this work commitment. I have school commitments. So we will work with them and we will get an aid in there as soon as we can to help the family. And obviously this is really, really critical, with everything kind of being delayed. They're waiting for Medicaid. They don't have the funds right now. They're strapped. So, this is kind of a very good middle ground for folks that need the help. And through emergency cases, we'll try to extend it as best as we can so no one is left, in an emergency situation. But it has really helped them. They are able to go shopping for them, take them to appointments, meal prep, all those things, and we're having a high demand right now with the winter. Some of the family members live other boroughs. They can't get there. So we can provide the help for them at this point. So it's really, really a unique service through the caregiver program. So the other service that we have is called a supplemental service, which is also a direct service to the caregiver. So we kind of supplement things. So we can actually purchase medical items, hygiene items, chucks, groceries. We use Fresh Direct and we send them groceries. We had about 4 or 5 orders this week from families that said they're really worried about the snow. And can you please get some groceries because I don't think I can get to my mom's this week. So we were able to set all this groceries up for their families, neighbors, and have them sent to the house. And it's a great service. They send us the list, we order it straight to the house. You don't really kind of hear that. So, I think it's just very important that we're getting that information out there. Caregivers are very much isolated. A lot of times they don't identify themselves as caregivers. They don't think they are. It can be a sensitive word. So we're very mindful of that. We say, hey, if you're helping someone, we want to get the service in to help out your neighbor, but we kind of need some support from you. So if you know of anyone, we always say just refer. We can always just give them information. But I feel like a lot of times the respite and the supplemental piece really drives people in because it's a direct service that really helps them and helps relieve a lot of the stress and financial situations. We've actually paid for lifts as well to get people to doctor's appointments because of an emergency situation. And we've also been able to help cover a few medical supplies that the insurance didn't cover. So we're really it's really think outside of the box. If someone needs something, we will definitely work with the family. So that's the caregiver program in a nutshell. I also put my information in there. So the other flip side is we also have an older adult center in Chelsea, 23rd Street. You guys may be aware of it. We are located in the residential building for the blind and visually impaired. It's Sellis Manor between 6th and 7th Avenue. So very accessible to get there for anyone. It is open to anyone, but we are primarily specialized in obviously the visually impaired. It's adapted. All the programs are adaptive. It's free. So like today we were able to switch to remote learning, but we do offer adaptive fitness. We have a fitness center that's open every day. We have yoga, dance, we have knitting, we have intertwine, We have support groups. We have tactile art classes, photography. We have writing, creative writing. We also have volunteer services for reading one-to-one that you can set appointments with. These are all volunteers who are background checked, that they can provide support in filling out forms, taking them grocery shopping nearby in the neighborhood. So we also have Zumba, and we have breakfast and lunch served every day for all of our members. So, if anyone's interested, they're able to sign up, fill out an application with us. If you guys need more information, you can send me an email. I could put you on the email blast as well of our calendar events. So you guys have it. If you know if anyone's interested, you can be in touch with us. It is a very good program. That's very accessible for everyone. And every day there's I think a program for anyone that will fit their needs. So and we also have technology classes, adaptive technology classes as well. So, for the blind and visually impaired, there's a lot of training that can be involved. We do a lot of one-to-one. We have iPhone classes and tablet classes as well. So, we really kind of have a wide range of services as well. So if anyone has any questions, please, yes, I'm going to put my email chat on here as well. It's easier if you send me an email directly, and you'll get added onto the group list for any of our programs. And then I'll also add you on, and then you can email me with any questions or any referrals that you may have as well. Thank you. I'll hand it over to Kathleen to our other, our big program at Visions.
Thanks, Liz. I am Kathleen McGuire. I am Senior Director of Rehab and Outreach at Visions. As Khadijah said, we provide services in the 5 boroughs, Long Island, Westchester, and the Lower Hudson Valley. We provide services in person, in people's homes, in the community, or at one of our 3 locations. We are fortunate that we can, there's space for us at our Older Adult Center in Chelsea, as well as our office on Greenwich Street, and then our residential facility up in Rockland County. We provide services to children from 3 and all the way through the lifespan to 100 plus. The services that we provide are vision rehabilitation therapy. And what that is instruction on daily living skills. So whether it's learning the skills as a blind person, or if you lose your vision, relearning the skills. And our therapists are master level trained in blindness specific, and they come into the home and see what skills someone needs to learn. So it could be using the microwave to make a snack, or being able to pour a drink for themselves, identify the color of their clothing, identify their medication. How do we do these things? Well, there's very low tech things that are simple things like maybe using large print or labeling different bottles by using different colors or rubber bands, putting little markers on the microwave. There are some adaptive devices that we're able to give. There's a device that is called an iBill that can read your money. It announces it. There's talking clocks. There's talking glucometers. There's talking thermometers. There's many different adaptive pieces of equipment, as well as we're seeing big moves in technology. Everybody wants to or needs to learn how to use their smartphone. Most people now do have smartphones. And the first thing, how to use it with the accessibility feature, whether they're using it to enlarge or they're using the voice. And then all of the apps that are out there for people who are blind and visually impaired. There's been a lot of advances in the last few years on things that we used to buy for people, and now it's in an app. We also might use a lot of people get the home device, like using Amazon Echo or a Google Assist. That's become very popular. Instead of giving people a large print timer and a talking clock, they're able to use those and use voice output for that. We also offer orientation and mobility, which is instruction on how to safe travel. And that might just be being able to exit your apartment in an emergency, or being able to exit your building to go outside and get paratransit, being able to find the mailbox in your building, or the washing, or downstairs for the washer and dryer, or people want to learn how to walk to the corner or the store, or the whole thing, which is maybe using the bus, the train. They have to travel to work or learn a route. I'm sure that many of you have seen people who are blind and visually impaired using long white canes. That's something our instructors teach. Not everyone is given a cane. Depending on how much vision they have, they might learn to use their vision, or there are, like I said, a lot of advances with technology that sometimes people are using Google Maps with the voice so that they can follow their route. So our instructors go and do an assessment and see what would benefit the person. We also have social work for benefits and adjustment to vision loss. It is short-term counseling, and if the person needs ongoing counseling, we are able to assist them to find a provider in their area. A lot of the things we do offer programs for teens that I think we do Prevoke, where we work with the teens on all of the things that I said, but also exploring work and getting work readiness skills and learning about advocacy. We do one at our older adult center. They let us have the space during winter break. So the kids 14 and above come every day for 5 days. We also do one in April where they go to our residential center for a week. And then we have 2 programs in the summer. We have a summer transition program, which is for young high school students of the 9th and 10th graders, where they do a combination of the vision rehabilitation therapy and the orientation and mobility. And they learn about advocacy and job skills. And they also do adaptive recreation. They go up to our campus up in Rockland County, which is 37 acres, and we have a pool and a lake, and all kinds of different activities that they get to participate in. And we also have a pre-college program that we, for students in junior and senior year at Manhattanville, where they stay for a month. They take 2 college classes. They also get any additional training that they need so that they can really see if they're ready to go to college, if they want to go, what skills they might need to increase their being prepared for college. And one of our other programs, which is really, really unique, is our family weeks that we hold at our Rockland campus in August. And they are for families who have a child who's blind or visually impaired from birth to age 21. We do 3 weeks. Each week has a different focus. The first week is for birth to age 10. And this is for the family for 5 days. So it's the child who's blind, any siblings, and anyone else that lives in the home. So parents, a grandparent, we've had an aunt or uncle come, or other guardian. And during the week, the children participate and work with our vision rehabilitation therapists and do activities. The siblings do a lot of recreation, and we have a lot of workshops and support groups for the parents. This service, this week in particular, because as you guys were talking about the lack of or not enough EI services, has become really popular because a lot of children under age 3 who are blind are not receiving EI services. Really, there is also a huge deficit of not having enough providers and not teachers of the visually impaired to go provide the services. So we have been seeing a lot of children under 3 come to our programs with their families. And it's really been wonderful because the families have the opportunity to connect and provide support and be a resource to each other. And it's really, they have a WhatsApp group that has really exploded. Like everyone's in it. So they share information and and they can work together. The second week is for children with additional disabilities. So we have one group for children that are blind and visually impaired, but they are really they are in wheelchairs and have severe disabilities. And then we have a group of children with that are more ambulatory and on the autism spectrum. And that week we do a lot of sensory things. And for that week, for the parents, we do support groups, and we do a lot of self-care, to make sure that a lot of them just want to have downtime. So that's the feedback we've been getting. And the last week we do is teens and tweens, and it's for 10 to 13 plus, depending on if the child's going to go into what the child's plans are. And we do adaptive sports, as well as also offering, we do a lot of pre-vocational things, talking about work, talking about advocacy, how to speak for yourself, how to talk about your vision loss and your other disabilities. So those weeks are packed. We last summer we had 58 families. So if you know anyone that you think might be interested, or that's something, I'll put my information in the chat so that you can get it out there. As far as our other services, again, for anyone, if they're over age 55 and they're not working and they want services, it is very easy. They just have to fill out a form and have it filled out by their eye doctor that states that they're legally blind. If they're under age 55 and they're not working, we do need to go through the New York State Commission for the Blind, but we can assist you with that process. Also, just as a shout out for our outreach piece, if you have, we do professional training, we do training for parents, we do information. If you have, a group of individuals that like to hear about our services, we're more than happy to go. We can do it remote, or we can do it in person, and we will, do it in the 5 boroughs, and actually we'll do it in all the areas that we cover if people are interested in having a training. So if anybody has any questions for Khadijah or Liz or I.
First, thank you guys so much. That was so informative, so helpful. If you guys can share some, I know you put a link in the chat, but if you have some flyers that I can post with this recording, I think that'll help aside from the link, because I know people are going to have a lot of interest in a lot of programs you guys talked about.
Sure, I'll send you those.
Yeah, so you can get them to me. I'll get them posted. And as you have events come up, please make sure, share them with me. I'll get them out. We have over 1,000 people on our mailing list, and plus on our socials and things like that. I can help spread the word for you guys.
That's wonderful. Thank you for having us.
No problem. All right. So I do see a number of hands. So I'm going to start with Carrie from Brooklyn Library.
Hi, this question is well, first, thank you so much for the presentation. I've worked with Visions for a very long time and learned some things today. So thank you very much. But I have a question for Khadijah. Khadijah, does your program work with transition age students in the Department of Education to help them with pre-vocational skills and exploring careers and things like that?
Yes, we do provide pre-employment transition services, pre-out services, I believe up to the age of 22. We actually have another team who does that, who is not here today. Jessica Clark leads those services here at Visions, but yes, we do have pre-out services as well.
Great, thank you so much.
All right, next hand is Chris.
Hi, guys. First of all, I do want to thank them because there is a reason. I've been working with them, as Carrie said, even years, but also they've been a very big help with the MTA accessibility, with the combo and the new combo and the Navalance, because they've been really big help of supporting all this in the past, and their programs are always wonderful. And their information, Brian, is a great time to get this out, because Vision has been working with us for many, many years. They used to have been with us on the Family Support Fair in the past, way before Joyce. This is what we're talking about, Karuna Heister. That's how long I'm talking about in the past. So they're a very reliable program, and I'm glad to see they're here today. It's good to see them here.
Thank you, Chris.
Debbie?
Hello. Well, I'm going to We have been working with you for a very long time because now chair of the advisory. I want everyone to know we did see your camp. We went up there, and I tell you, I loved it. I loved the way that you had different ways for people to figure out how to get back and forth between their camp with the ropes, the handles. I thought it was fantastic. The other piece I have to say is the on the one on 23rd between 6th and 7th, Ellis. We've been meeting. We used to meet there with the New York City. We worked with a few groups that would have meetings there. So we really were very. I always, whatever I've seen you, always been helpful. And we did used to have you at our family sport fair. We miss you. We hope you come back because a lot of times it's not just the children who have visual. A lot of the parents have visual issues and disabilities, and they need the backup help too. So keep up the good work.
Thank you.
Lucina.
Hi, good morning, everyone. Thank you so much for that wonderful presentation. Because I have a parent who's a caregiver and her husband just recently became blind. So I wanted information, and she has a child with disabilities. It's like doing double duty as a caregiver. Do you come to the home, or does the individual come to your facility?
So it depends. Whatever works best for them. We have been doing for the people that are 55 and over.
Mhm.
We have started groups. It was in order so that the first thing was to decrease our wait list, but also to maximize. And I have to tell you that the groups have really been a huge success because people, as you know, that are blind and visually impaired have a huge feeling of isolation, and the groups have really brought people together and created a community. But if that doesn't work for the person for a very, whatever it is, we will go to their home. It's what's best for the person. Also, I didn't say this, we provide services 7 days a week. We're very flexible about time. I've had staff go out and see people at 7 in the morning, and we've had staff, see someone at 8 at night, if they're working and they still need services. So we really try to work with people to what works best for them and make any accommodation that we can.
And who do I contact? The email, which is the email for the individual? I mean, he's not, it's considered a disability, but who do I send that parent to connect with to do the process, the evaluations?
For caregiver or for him to have services?
Both.
I'll put my email in. You can contact me.
Okay, thank you so much, Catherine. That was a really, really good presentation.
Thank you.
Trudy?
Catherine, Elizabeth, thank you so much for this presentation. It was very informative. I'm so happy to hear about this service because from an educational perspective, I do have a student who gradually lost his vision, and mom has tried through the district to for impartial hearings, lawsuits, you name it. And even though the impartial hearing comes back saying DOE is responsible to provide vision services and educational services, no one comes in, no one comes to the school, even though we advocate. So I am going to email you both. The student graduates actually next year. And so we are not a school for that. So your help will be really appreciated. So I will get in touch with you. That's what I wanted to say. Thank you.
Rochelle?
Yeah, again, thank you. You have an amazing program. And one of the reasons I was so delighted for you to come is that we have, as we've discussed earlier, a growing aging population of people with IDD and their parents and caregivers. We're all getting older. And as you age, there's more potential for visual impairment. Also, there are certain particular visual disorders that are associated with people with IDD, such as keratoconus for individual with Down syndrome, which can cause actually the need for a corneal transplant if you can get one that works for you. And so I just think there's going to be enormous growing need for these kind of services for our population. And I think it'll be good if we continue to work together to customize the services for people with IDD with growing visual impairments. and how their agencies and their families and they themselves can improve their quality of life. So thank you so much.
All right. I don't see any other hands or questions. But again, this is recorded. This will be posted on our website. Your contacts are all in the chat. The chat gets posted on our website. And if you have any specific flyers or anything like that you want me to share and post, I'll do that as well. But again, this should be an ongoing partnership. We will share resources. I'm sure it will benefit many families that in and around Brooklyn, whether they know of us yet or not, we'll be able to get messages out to them. So thank you guys so much for being here and for sharing this information.
Thank you
so much. Yeah, reach out to us. We are more than happy to present anywhere else if you guys need anyone individually, please. Thank
Excellent.
you. Be safe.
Thank you so much. All right. Next order of business. I think, Chris, your MTA update.
I'm ready. Just let me finish everything so I can process what I have in my head, because right now my head is ready. My hair's already growing up. First of all, good morning, everyone. Happy New Year. As you're aware, as of January 1st and the 4th, you know that A, there's no such thing as Metro cards. 2, please be advised that if you have not switched over to your Metro card to your Omni, you can actually still get the Omni reduced fare card in any location customer service centers. Those information I sent to Brian. Please note that we also added additional more customer service centers that just opened, going from Canarsie to East New York to even to Sunset Park, all the way out to Coney Island, which is the first one was open, all the way out to Queens. So please check the websites. Please note, not all may not be 100% ADA accessible, but there are ones that are truly ADA. And the reduced fare vehicles will still be around. And they will be joining with me at the resource fairs. But please note, we cannot switch over your Omni cards there. We can only give you the information how to register your card. And as a reminder to everyone registering to your Omni card, please make sure your card is secured. Doesn't matter if you have two cards from a reduced fare and accessorized. You can have both cards. And I want to be very clear on the record. I said this to all DD councils. An Omni reduced fare and accessorized are two different Omni cards. You can have both. In case one goes down, you have a backup to get to your destination. Please note that the accessory one does have a picture. The other one does not. The one will have, it says RF. So if you lose the RF card, which stands for reduced fare, you can get another one in the customer service center, like a snap of your finger. Okay? And as a reminder, the fare has gone up. Full fare is $3. Reduced fare is $1.50. Long Island Railroad, which is in the Brooklyn stations, it went up a quarter. So as we're right now in the midday times, that is now $5.25. During the rush hour, it's $7.25. But if you're traveling as a reduced fare customer, which is seniors or disabled, you can also do, which I call it the city ticket, which is the city reduced fare ticket as well. It is $3.50. So please make sure you show your RF or your accessory card as well. As a reminder, thank you, Kerry, for putting that in. Also, just to remind everyone, as we're dealing with the weather right now, and I have been in touch with Jano, the MTA subways are running, actually, ready for this, running actually 100%. Long Island Railroad, where Brian, your train is running, but running on a Saturday schedule, not on a weekday, as well as the Metro North. They will add additional trains, so those are called the bonus trains. So we in New York are running 100%. New Jersey is not running, only the PATH train. So if you're traveling on Amtrak on the Northeast region, there are delays because of Jersey issues. And the meanwhile, the MTA committee meeting was moved from today to Wednesday. And we also have more additional accessible stations openings. We have a couple of them opening in the Bronx. Borough Hall will be opening possibly this Thursday. I will keep you guys informed on that. And all MTA information will be up to date. Now, I do want to remind everyone, please check your Omni cards so you can switch them over to your account. And therefore, you can keep your balance balanced. So you can put in a reduced fare, accessorized, and if you want to keep a full fare Omni card, that is your choice. You can put 3 of them. But please do not try to put in 2 reduced fare or 2 accessorized. They have to have your own account, your own email. It doesn't matter if the parent's controlling it, they have full control of it. If you have any questions or concerns, please let me know. And reminding you, since we're in a snow alert, please note that all MTA buses will not run a normal schedule. They will move the best we can, but if you see a bus stop that has not been shoveled yet, please put it into 311. This is a DOT and sanitation issue, not an MTA. Only a train stations that has not been shoveled properly, if you see ice, you can let them know or put it into the MTA customer feedback or 511 and you get a reference number. But please know, MTA has nothing to do with the bus stops. That is the store owners, property home, whoever lives, or if it's at a station that's linked to the bus stop, yes, the MTA will shovel. But I remind you that we still need to let sanitation and DOT know this at this time. And just to remind everyone, please be safe out there because ice and snow can slip. So please do not try to run like a marathon out there. If you have any questions, I'm here. Thank you, Brian.
Thank you, Chris. All right, at this point, we can open it up for agency program announcements. So just put your hand up and I'll go through the list as people pop up. You can also make sure, I know people were, put all announcements in the chat as well because that also gets posted. First hand I see is Doris. Doris, you're muted.
Yeah. Hi, good morning, everyone. Thank you, Visions, for that most informative presentation. My name is Doris Khan. I'm the Outreach Coordinator for New York State Institute on Disability. We have openings for evaluations for OPWDD eligibility for individuals who do not have Medicaid and reside at home in the Brooklyn, Bronx, Queens, and Staten Island. For information, contact Elizabeth Sunshine at 917-699-0578, or you can email her at esunshine@nicidinc.org. NICID also has openings for crisis management services for individuals who live in the Bronx, Brooklyn, and Queens. We do not provide crisis management services for individuals with self-direction. For information, you can contact Juliet Hawkins at 917-524-4856, or you can email Juliet at jhawkins@nicidinc.org. NICID also provides reimbursement for goods and services and for camp for individuals who reside in the 5 boroughs. Contact Jackie Tribodi, 929-202-1115, or you can email Jackie at jtribodi@nicidinc.org. NICID also has tickets for outings for individuals who reside in Brooklyn, Bronx, and Queens and Staten Island. We do not have tickets for individuals with self-direction services or if the individual resides in Manhattan. You can contact Sarah Alton at 718-494-6457 or email Sarah at salton@nicidinc.org. NICID also has free transportation services for medical appointments or recreational outings for individuals who live in Brooklyn, Bronx, and Staten Island. Please contact John O'Grady at 917-747-9424 or jogrady@nicidinc.org. Brian, I put all that information in the chat. Anyone wants to
Thank you so much,
have
Doris.
more information. I put the flyer in the chat with all the numbers. Thank you.
Thank you. Next up is Carrie.
Evaluations in person or
Hi,
remote?
Al.
Hold on one second, Carrie. There's a question for Doris.
Were those evaluations in person or remote? Apologies for interrupting. I put it in the chat. It wasn't answered.
Doris, are you still
Ms.
here?
Khan,
Yeah,
Are those
those
evaluations in
remote
person
or in
or
person?
remote?
they're in person. The person goes to the family's home. Wait, did you hear me? Wait.
Yes. So the evaluator goes to the person's home.
Right, but that is left to the individual and the evaluator. During COVID, of course, everything was remote. And then there was, that has been limited. So now the person goes into the home and they can discuss that with the evaluator.
Thank you. All right, go ahead, Carrie.
Hi, all. Again, Carrie Banks from the Brooklyn Public Library. So I put a bunch of things in chat. I would like to highlight two of them. One is Gary Schulman. Many of you remember him, and for those of you who don't know him, it's worth checking out. We'll be talking about supporting our children and becoming self-advocates. And by children, we mean birth through retirement age. And helping them develop the skills that they need to be self-advocates. And the child, doesn't need to be someone who speaks. It doesn't need to be, someone who is naturally outgoing or anything like this, particularly not. We want people to be able to have input to decisions made about them, to make decisions where they can. And we do not do this well as a profession, excuse me. But, from a very young age, we need to be offering children options, questions, letting them have input into their self-care. What color shirt do you want to wear today? Something as simple as that. But it starts young, when kids are young, and it goes throughout their lives. And we need to be, so there's another skill we need to be helping our kids develop. And our kids in the broadest sense, and adults develop. So there's information in the chat, and I will put it in again. That's one thing. And then the second thing is I am very, very excited to announce that we are regularly doing programs in Mandarin at the Sunset Park branch for school-age children. This is the first time we've had regular Mandarin language programs in many years. We're doing once a month on a Friday, and I will also put that information in the chat in English and Chinese. So please help us get the word out. Thank you.
Thank you, Carrie.
Excuse me, Brian.
Sandy.
I have a question. Brian, this is Chris. I do have I want to add something what Carrie mentioned earlier, and it's on the chat because this is related to the library. Everyone to please remind to please, if you're attending the Development Disability Resource Fair, please note that the February 13th has no more space. You can still come because we do have an information table. So I want to be very clear, as Carrie's already mentioned it. And I want everyone to be aware, it's also, her information is also on her website as well as on both councils. Thank you, Brian.
Thank you, Chris.
Sandy?
Hi, everybody. Sandy Naper from ADAPT Community Network. We've got two great webinars coming up. The first one is this Thursday, January 29th, from 10 a.m. to 11:30 a.m. And the New York City Department of Education's personnel will be discussing some of their innovative programs for children with disabilities. Some of those programs are SEED, ACES, PATH, and bilingual education. SEED, by the way, is sensory education, exploration, and discovery. And on February 5th, Thursday, 10 a.m. to 11:30 a.m., we're doing transition to kindergarten, moving from preschool to kindergarten. And Liliana Diaz-Pedrosa from Advocates for Children will be our speaker. To register for these programs, you can click on the links that I put in the chat, or you can look at the flyers that I dropped in the chat. And we always have Spanish and Mandarin interpretation. Thanks, everyone, and keep warm. Bye.
Thank you, Sandy. All right, Matthew.
Hello, everyone. This is Matthew with YI. Hopefully, everyone is staying warm. I am here to promote the Independent Living Skills Program. It is scheduled to start next week on Tuesday. However, there might be a slight chance that we push it 1 week due to the snow, but that remains to be seen. If you have any referrals, please do send it to me at group training at yei.org. I did include the flyers in the chat. Also, Brooklyn Ballet Yoga and Social Skills is also taking a few more applications. And feel free to also look at the flyer and the send any referral to group training at yei.org. And that's about it.
Thank you, Matthew.
Yeah, no problem.
All right. I don't see any other hands or anything else in the chat. So thank you everyone for attending and making it through your shoveling and whatever else you had to deal with yesterday and this morning to make it on here. Just as a reminder, our next meeting is Monday, February 23rd. Same time, 10 a.m. on Zoom. We are going to have a presentation by the CUNY Steps 2 program. And anyone that's not aware of them, they've been at a lot of our fairs. They support the autism and DD community, individuals ages 16 to 27 years old living in New York State. They have 6 free online health education classes, and they offer paid stipends for completing surveys. So they will come on and do a presentation next month, February 23rd, in addition to our updates from our friends at OPWDD, IAC, and everyone at the council. So thank you guys. Stay warm, stay out of the ice and snow, and see you guys soon.
All right. Have a good day.
Bye, Brian.
Bye.
Bye,
everybody. Stay warm.
Bye. Take care. Bye. Bye-bye.